Sometime last year, 52-year-old Jacinta Wanjiku Wangare slipped and fell. She dismissed the small accident and went on with her life.
Because I slipped and fell, but it was not, even I didn't go to the hospital. Ika heal, the pain went away. I didn't take much, whatever, seriousness.
It was not until early March this year that her life took a different turn. She says that she felt a sharp pain in her hip joint and had to be rushed to the Diani Beach Hospital, which is not far from her Ukunda home.
I was just doing my normal things. Kaskia sharp pain. I couldn't walk again. Hapa kwenye joint. So it was that. So I had to go to the hospital. Ndio nikapigwa x-ray, ikaonekana imevunjika. Even I didn't know imevunjika. Nilipopigwa x-ray ndio nilijua imevunjika. I was astonished because I didn't know. Yeah, it came because I have never felt again. So I think when I fell, it cracked. Sasa bila juzi, sasa after 4 weeks ago, maybe ndio ilikuwa inamalizika. That's why I felt that pain.
She's been having pain kwa miguu. Huku chini alikuwa anafura. Basically kabla tukuje to find out like anze hiyo the hip pain, alikuwa anafura miguu. So I was in Dar es Salaam hiyo time akinicall, akanambia I'm not feeling well. So niliporudi nikaenda nikampeleka tu for massage. You know the way you can say it's not a big deal, amefura tu miguu. So I used to take her for massage. Anarudi nyumbani, anaendelea tu na kazi zake za kawaida. Until one day when she told me alikuwa hawezi kumove and the pain was so persistent. So nikamwambia now it has come to be serious, we have to go to the hospital. That's when we came here.
The doctors who treated her that day advised her on the options she had to rescue her damaged leg.
Then I was advised on what is the best. There were different procedures, but I was advised on the best. Yeah, full hip replacement. Yeah, it was scary, but the doctor encouraged me told me it's the best, and it won't bring any problems.
Definitely tulienda kwa daktari and they had to do the x-ray. Then that's when we realized that tuliona actually it's even showing that I'm a break. Apparently there were so many types of procedure tulikuwa tumekuwa advised on, but the doctor now, Dr. Kiran, he said that this will be the best procedure for her, the full hip replacement. So actually Dr. Kiran is very nice because alikuwa anatuambia vitu na anafanya practically. Yeah, he had all those bones and za kutuonyesha like how it will be like if it's full, if it's half. So we thought like it was a good idea and the advice he gave us. So basically lazima tungeenda nyumbani to discuss with my brother. It's just us, the family, the kids and my siblings and my mom. So we had to sit down and see what we can do. So after 2 weeks we came back.
A hip replacement surgery is only recommended when the hip pain limits an individual's everyday activities such as walking, bending, or moving around. It is also recommended when one experiences hip pain when resting, sleeping, or also has stiffness that limits the ability to lift the leg or faces inadequate pain relief even after taking medication or undergoing physical therapy. The surgery also has no weight or age restrictions. Total hip replacements are done based on a patient's pain and disability and not age. The hip is one of the body's largest joints. It's a ball and socket joint. The socket is formed by the acetabulum, which is part of the pelvis bone. The ball is the femoral head, which is the upper end of the femur or the thigh bone. In a total hip replacement, the damaged bone and cartilage are removed and replaced with prosthetic components. The damaged femoral head is also removed and replaced with a metal stem that is placed into the hollow center of the femur. The femoral stem may be either cemented or pressed to fit into the bone.
Yeah, this is part of your pelvis. Now this is my left hip. So this is how it is anatomically, right? So what happens here is that in replacement, we take the head away, the old head, the damaged head. We can even do hip replacement for patients with severe arthritis also. That's what we do. So we take the hip away, the native ball away, and then we push this. It's called stem. And this is uncemented, and this is a cemented. You have a variety of options. You have ceramics and stainless steel, cobalt, chromium, oxynium, and all that. So we depending on the patient or condition, we choose which one to use, and then we push this one inside this bone. So this will be inside the bone, right here, and then we change this head to a metal head. This is a metal head. So we put that there, and then same way with the shell, with the cup. Yes. We grate this cup, and then we remove all the cartilage and everything which is there in the cup, and then we replace it with this metal shell, okay? And then we put this plastic, because a metal and metal cannot rub against each other, isn't it? Yeah. So we put a specialized plastic, it's called polyethylene, right? And then this is your new hip. So in that way the pain goes away. There's no contact with the bone, isn't it? So the pain goes away. So
the preparation was okay. I had to be inaitwa nini anesthesia. Yeah. Then the operation ikafanyika. While kama nikienda kwa nini hata singeweza kukanyanga chini, nilikuwa na bebo na mgongo.
All alone.
Kutoka nyumbani.
Dr. Kiran, a consultant orthopedic surgeon and a joint replacement specialist at Diani Beach Hospital, explains why the patient needed a full hip replacement.
She presented with pain in the hip. She was not able to walk for about 3 to 4 weeks. She was in bed. So she came to me. I did her examination, and then we x-rayed her, and then we found out there is a basic cervical fracture. So she had a couple of options. So the best one was to do a total hip replacement, and that's what we did. It went successfully, yeah.
Why did you prefer the hip replacement?
Why did I prefer the hip replacement? See, the thing is, this is a hip bone, yeah? This is a femur.
Yeah.
Now, the blood supply gets cut off when there's a fracture here. So this is what she had. If there is a fracture here, then we have other options to fix it. We can do a PFN, we can do a DHS and other options, and then we can retain her normal hip. When then the fracture is here, which is called the head of the femur. When there's a complete fracture here, the blood supply to the head goes away, and then eventually it will go into something called as a necrosis, osteonecrosis. So for such patients, we have two options. We can do a bipolar or a total hip replacement. The longevity of total hip replacement is much better than the bipolar. So that's why we had to do a total hip replacement.
The mother of 4 narrates that when she couldn't walk, her children became her pillar. They could bathe her and help her relieve herself. At some point, she thought she had lost her leg and could never walk again.
Ninafeel nimeenda chini. Because siwezi nikamove, kila kitu lazima nifanyiwe. Hata ukiniacha hapa, I can't move. But now I can move, I can do everything now. Mostly ni kunibeba, kuniketisha pale ninataka kuketi. Then they do the normal things. No, siko kazini, lakini I have things I do in the compound. Lakini sasa singeweza kuzifanya. Yes. Nilikuwa naona hata sitatembea tena. Because if I couldn't touch the ground. Nikikanyanga tu hivi nasikia uchungu.
After a successful hip replacement surgery, Jacinta was able to walk the next day, and she can't hide her joy being able to stand on her 2 feet again.
See, ideally the next day, in the morning after the surgery, we make the patient stand up and walk with the help of a walker. They will be able to put their full weight on the leg without any problem. And on the second or third day, we make them go up and down the stairs. and about 4 to 5 days we discharge the patient home. We make sure that the patient is independent, that she is able to do her activities when she goes home. Yeah, for the complications are the same like for any other surgery. In orthopedics, we take care of infection, which is a prime complications. So we take care of that, and you have embolisms, and we have during the surgery you sometimes even encounter some fractures. So these are all the complications, but the complications are same like any other surgery, like even doing a cesarean section is the same complication basically. A surgery is a surgery.
It was still numb. Nikalala for that night. In the morning, the doctor came, told me, you have to walk. Nilikuwa naogopa, but I have to, because if I don't do what the doctor is saying, I won't pona. Well, I'm feeling good. Ni vile tu nachoka. Ningependa tu kutembea.
Implants used during hip replacement surgery can last up to 25 years, and what is used varies from patient to patient depending on their age. The hip replacement surgery takes approximately 2 hours to be done.
The life of these implants for this one is about 20 to 25 years, right? And you have oxynium. The life is about 35 to 40 years. And you have ceramic. So it depends on what material you use. So depending on that, you choose your patient. So we make sure that we do a surgery once in our life. But sometimes due to some complications or any fractures, we'll have to revise it. So if a patient is younger, we use a better, long-lasting implant. Yeah. And for example, the same case, yes, like Jacinta comes to me and let's say she's about 80 years old. Then we can go with a simpler implant. It's called a bipolar.
Agnes Mudhoni is the second-born child of Jacinta Wanjiku and has been nursing her mother in the hospital. She had to abandon her other businesses to ensure her mother's health is restored. She narrates that seeing her mother walk again gives her joy beyond measure.
For me, I think it's a miracle. Yeah, it's a miracle because basically we were scared that she might lose the will to live because she thinks and I imagine everything has changed. I can't move, I can't, because basically kumpeleka toilet ilikuwa inabidi tumpeleke, kumuosha, kumlisha, everything. And it was just us doing that. So seeing her walking, for me I didn't even believe it because Dr. Kiran said after the surgery it won't take her long to walk. But I never thought it will be so fast. Like the surgery was yesterday and the following day she was walking. It was, for me, it's a miracle.
Wanjiku's prayer is for people to take their health seriously. Now that she can walk again, she hopes to maximize her time and live her life to the fullest.
Yeah, sahi hata imenifunza, don't ever take anything for granted. Because me, I was walking, I was doing my things, and then all of a sudden, nothing. I have to depend on people. It was so saddening, but now I'm happy. I'll be able to do my things.
Apart from fractures, other conditions such as arthritis may require one to undergo a hip replacement surgery. The most common cause of chronic hip pain is rheumatoid arthritis, osteoarthritis, and traumatic arthritis, which is a hip injury. Globally, more than 350 million people are living with arthritis, which can get distressing if not managed properly. Arthritis is a degenerative joint disease that causes wear and tear in hips, hands, and knees, hence lowering one's quality of life by causing pain and disability.
These implants were designed to cure arthritis, and then we also do it in certain fractures and all. So yeah, basically the arthritis is the one where we advise the patients to get a replacement. But surgical joint replacements is not the only answer for arthritis. We have different kinds of modalities of treatment. It all varies on depending on the type of arthritis and the stage they are in. Yeah, see, arthritis is basically a disease of the joint. It is an inflammation and degeneration of the joint. So when I say joint, see, this is your femur, which is there, right? Your thigh bone. And this is your leg bone, it's called tibia, it is right there, right? So here, you have something called as a cartilage. So arthritis is the disease of this cartilage. So what happens is that when someone has arthritis, this cartilage starts to break down, and then eventually the bone gets into contact with this other bone. And then the patient will have experience something called like a grating kind of a sensation in their knees, with pain, of course. So now you know the reason for the pain in arthritis, isn't it? It's the contact of bone with the other bone. So when you do the replacement, you change it, you shape this bone, right? You measure the different types and sizes of the implant. You measure that thing, and then you put this here, yeah, into this bone, and you resect the part of the diseased part of the bone. You place this inside this bone, right? Between them, you put this specialized plastic called polyethylene. So now there is no contact with the bone. It's on the metal and this plastic, isn't it? So the pain goes away. In fact, immediately after the surgery, the patient will not experience the pain she was going through before.
Patients with arthritis have symptoms like pain that starts gradually and worsens with time, stiffness in the joints, and difficulty in motion like going up and down the stairs. For a patient with arthritis to undergo a joint replacement surgery, it depends on how advanced the condition is.
Right. So arthritis, as we all know, will not kill a patient, but of course it's going to affect the quality of life of the patients. Majority of them are going through their day-to-day activities in pain, and pain is not a nice thing. You know, one of the things that brings a patient to the hospital is obviously pain. And arthritis, like Dr. Kiran mentioned, is managed in various steps. You know, if the early stage a patient comes, you can manage them with medications. Probably a little more advanced, he will probably do like intra-articular injections, what he discussed, to alleviate the pain. But of course, a vast majority of the patients who have really extensive arthritis of the joints will probably go in for knee or a hip replacement surgeries. So these hip replacement and knee replacement surgeries are, like Dr. Kiran mentioned in his interview, something that you don't have to be scared of. It is an extremely easy procedure, easy in the sense that it's going to take less than about 2 hours. And once the procedure is done, the patient is now within 24 hours able to walk independently without any assistance, without any pain. And I feel that joint replacement surgeries may make a large difference to the elderly population.
The patient comes in stage 1, yes. We can give some oral painkillers, non-steroidal anti-inflammatory agents, or paracetamol can also work. And we advise the patient to change her lifestyle. Or his lifestyle. Like if the patient is overweight, we advise them to lose weight, to stop smoking, reduce the consumption of alcohol, right? And then we, in another stage, stage 2 or early stage 3, we have something called as an intra-articular injection. So what we do is that we give a cortisone injection into the knee joint, into the joint or hip or the knee joint. And then we can also give some viscosupplement injections that will lubricate the joint. Now in stage 4 is when we advise for the surgery.
So how can one prevent themselves from getting arthritis?
Of course, the way you prevent gouty arthritis is stop taking alcohol, reduce intake of red meat, and to overall, to stay away from arthritis is you need to lose weight, you need to exercise well, you need to have a healthy diet, you need to go for regular walks. Yeah. And in elderly, you should prevent fall. Yes, I always advise my patients that if someone is suffering, like if someone is struggling to walk, of course, even though if they don't have any pain, with age, they cannot walk like, how we walk, how a ramp model walks, isn't it? So we advise the patient to start using a cane or a walking stick just to prevent fall.
But there's one thing you cannot prevent is aging. So as people age, more and more people would definitely have issues in their joints. And so these are the kind of people who would obviously need procedures like the hip and knee replacement surgeries.
Arthritis is curable and manageable through treatment, but when the condition has advanced, surgery is advised. Build in. Walieula KT News.